Cardiomyopathy in babies refers to a rare but serious condition where the heart muscle becomes abnormal, affecting its ability to pump blood efficiently. It can be caused by genetic factors, infections, or other underlying health conditions. The severity and symptoms depend on the type of cardiomyopathy. Types of cardiomyopathy in babies. 1. Dilated cardiomyopathy (DCM). The heart's ventricles become enlarged and weakened. Most common type in infants and children. 2. Hypertrophic cardiomyopathy (HCM). The heart muscle thickens, making it harder for the heart to pump blood. 3. Restrictive cardiomyopathy (RCM). The heart muscle becomes stiff, restricting its ability to fill with blood. 4. Rhythmogenic right ventricular cardiomyopathy (RVC). A rare condition where the heart's muscle tissue is replaced with scar or fatty tissue. 5. Left ventricular noncompaction (LVNC). The heart muscle has a spongy appearance and is not fully developed. Symptoms of cardiomyopathy in baby. Symptoms can vary depending on the type and severity of the condition. Common signs include 1. Breathing problems, rapid breathing or difficulty breathing. Increased work of breathing, flared nostrils, grunting. 2. Poor feeding and growth, difficulty feeding or refusal to eat. Failure to gain weight or grow as expected, failure to thrive. 3. Fatigue and lethargy, unusual tiredness or lack of energy during feeding or activity. 4. Sweating, excessive sweating, especially while feeding. 5. Swelling in the legs, feet, abdomen, or around the eyes due to fluid buildup. 6. Pale or blue skin, cyanosis, bluish color due to poor oxygenation. Pallor or grayish skin tone. 7. Rapid heartbeat, abnormally fast or irregular heartbeat, arrhythmia. Possible signs of heart palpitations. 8. Frequent respiratory infections, increased susceptibility to lung infections like pneumonia. Causes of cardiomyopathy in babies: genetic or inherited factors, mutations in specific genes. Metabolic disorders, conditions like pump disease or fatty acid oxidation disorders. Infections, viral myocarditis, inflammation caused by viruses like Coxsackie virus or adenovirus. Nutritional deficiencies, lack of essential nutrients like thiamine or selenium. Structural abnormalities, congenital heart defects. Exposure to toxins or drugs, in utero exposure to harmful substances. Diagnosis: if cardiomyopathy is suspected, doctors may perform physical exam. Listening for heart murmurs or irregular rhythms. Echocardiogram echo. Imaging to assess heart structure and function. Electrocardiogram ECG. Measures electrical activity of the heart. Chest X-ray. Identifies an enlarged heart or fluid in the lungs. Blood tests. Checks for genetic conditions, infections, or metabolic disorders. Cardiac MRI. Provides detailed images of the heart. Cardiac MRI. Provides detailed images of the heart. Genetic testing. To identify inherited forms of cardiomyopathy. Treatment options. Treatment depends on the type, severity, and cause of cardiomyopathy. 1. Medications, beta blockers or ACE inhibitors, improve heart function. Diuretics, reduce fluid buildup. Antiarrhythmic drugs, manage irregular heart rhythms. 2. Nutritional support, addressing deficiencies or metabolic issues if identified. 3. Lifestyle and feeding support, high-calorie formulas or tube feeding for babies with poor growth. 4. Surgical or interventional procedures, pacemakers or implantable cardioverter defibrillators (ICDs) for arrhythmias. Heart transplant in severe, untreatable cases. 5. Monitoring and follow-up, regular evaluations by a pediatric cardiologist. Prognosis. The outlook for babies with cardiomyopathy depends on the type, underlying cause, and response to treatment. Early diagnosis and management can significantly improve outcomes. If you suspect any symptoms, seek immediate medical attention for appropriate testing and care.